hospice really is almost more a philosophy of care than a type of care even. And what I mean by that is in hospice, the patient is really put at the center of a team of individuals who are there to make sure that the patient receives exactly the kind of care that they need at the end of their lives. But hospice is not simply about medical care. It's about total care of the individual, even care of that individual's family and loved ones. So typically hospice, in addition to having healthcare workers like doctors and nurses available to the patient, there are many other kinds of caregivers available as well. Everything from spiritual care and social workers working really to ease suffering for people at the end of their lives. The typical hospice patient is taken care of in their home. Usually the team goes to the patient, but that's of course not always possible, although it usually is the preference of the patient. There are various venues in which hospice services are offered. Sometimes, for example, you'll have hospice really starts in the hospital, and it's particular. In the hospital, these are patients who are very sick or frail. They need quite a bit of attention, perhaps around-the-clock care, or they may also be identified as being hospice eligible while in the hospital. Another place you'll often find people receiving hospice care would be in places like hospice houses. So some folks who are receiving hospice don't have family or friends that can take care of them, or they don't have the financial means to stay in their home. Or certain hospices approach the patient with this awareness that sometimes patients benefit from living with other patients who are also receiving hospice. So you'll often see people living together in a hospice house. And some hospices also have their own version of an inpatient facility. So people who are, it's not a large percentage of the typical hospice patients who end up there, but you will find sometimes when people need a large amount of nursing services in the last typically just a few days or a couple of weeks of life, then they'll be admitted to a place that's called a hospice, like an inpatient hospice facility. But those also don't usually look like hospitals. Those look more like, they work very hard to make them look as uninstitutional as possible. There's no age requirement to go to hospice. There are children with terminal illness. There are people who are in the middle of their lives who have terminal illness, and of course then the elderly. In fact, hospice really grew in the 80s and 90s with HIV patients, and that was a new cohort or group of people who needed hospice services. But there have always been people who've needed hospice service, at all stages of their life. In fact, here in Florida, every hospice is required, or every hospice, I believe, is required to offer pediatric services as well as adult services. So that's a sad but real part of the work that's done in hospice. The way one qualifies for hospice is the basic requirement is that the patient is certified by a physician to be within the last 6 months of their life. Now, oftentimes that's a very difficult decision to make sometimes, so the doctor and the hospice team will use certain criteria to make that decision. For example, there are certain indications in Alzheimer's disease or Parkinson's disease or heart failure or certain cancers that life expectancy is less than 6 months. However, these are not airtight indicators always. So sometimes what will happen is a person will be admitted to a hospice program and they'll exceed the 6-month life expectancy. Documenting continuous decline in the patient is another way to keep a patient in hospice even if they've exceeded the 6-month limit. Most people who enroll in hospice are covered by Medicare. There are some difficulties with Medicare. If a person exceeds their 6-month life expectancy, there are instances in which Medicare will stop paying for that care. And there are different companies that run hospices. Some are for-profit, some are non-profit. There are a lot of folks who are very committed to the non-profit model of care because the belief is that hospice is a very complex and expensive and program, and that it's, at least in my experience with non-profit hospices, people feel there's always more that can be done. So the places where I've worked that are non-profit hospices, I think people are committed to this idea that whatever money is earned it's a benefit to the patient and the program if they can plow that money back into the program to offer more and more complete service. The hospital, if you think about it, is geared to keeping people alive and really offering dramatic measures to keep people alive. So it's almost an endless availability of tests and procedures and different kinds of therapeutics and surgeries and you name it, it's available in a hospital. And typically a team of doctors in a hospital, it's very hard for them to ever put the brakes on those services. Hospice, on the other hand, is a fundamentally different approach to the end of life. Their goal is, once a person is determined to be terminal, rather than doing everything they can to extend life, their goal is really to increase comfort. So most of these highly invasive procedures are not part of the hospice hospice care, but rather the whole focus on care is not cure but comfort. So all hospices are different. One common theme is that care in a hospice is driven by what's called the interdisciplinary group, or various members of the care team, various kind of healthcare specialists. So each hospice offers a different kind of care. Probably some hospices will even offer chemotherapy in the hospice, and others won't. So while the kind of care in every hospice is different and determined by the style of the individual hospice, there are certain common themes, and that is that the care is driven by this interdisciplinary team of healthcare specialists. One of the fundamental tenets of hospice care is that human beings are more than just their physical body. They're also their emotional and spiritual sides. So the other belief of hospice is that people are really not alone typically on this world. They have their community and their family and their loved ones and friends. Or even some people who do seem alone, they are also in a community of other people who are suffering the way they are. So hospice works to address this emotional and spiritual side of people by offering pastoral care that would be specific, or that attempts to be specific to that person's individual spiritual beliefs. They even extend services to the family as far as grief counseling goes. They typically have support groups for patients. They really try to focus on easing the patient's suffering, not just physically, but also their psychosocial, spiritual suffering as well. A key element of hospice is that volunteers be part of the team. So every hospice is expected to recruit and use volunteer services, and of course that's important because the families of many hospice people also want to give back. So it's actually not just good for the patients, but it tends, I think, to be good for the volunteers as well. You'll see physical therapy, occupational therapy there. There's nursing assistants to help with personal care and hygiene. And then, again, depending on the hospice, you may see other things present as well. I know I've worked with people who have experience in hospice with massage therapy, acupuncture. Sometimes you'll have homeopaths available. Different hospices bring different people in as they identify as necessary. But the key is really psychological support, spiritual support, volunteer services, and then medical support. When people are suffering a terminal illness, they want to be in a place where people understand how to ease their suffering and take care of them as best they can. So a lot of people choose hospice because they don't want to be, poked and prodded with more medical tests. They don't want more therapies offered. They don't want to go down these paths which really sometimes just increase suffering and don't extend life. But people choose hospice for other reasons as well. There's the benefit to the family. There is the fact that being around people who are experts in helping patients deal with those again, psychosocial and spiritual needs that present themselves at the end of life. Being in an environment that really fosters that healing is important to a lot of people. So after death, what really sets hospice apart from other kinds of care is the focus on the patient's loved ones. So bereavement counseling is a very big part of the work hospice does. People who are part of a patient's, meaningful people in a patient's life, people who are suffering after a patient dies, are typically offered the opportunity to speak with counselors. It's usually a free service to help them process their emotions Hospice do other things as well. I know the hospice in Tampa offers community services for people who weren't even hospice patients. For example, for people who are dealing with the death of children in their family.